baby after baby, mother after mother, family after family.
The biggest maternity investigation in NHS history has found yet again services were chronically understaffed and women weren't listened to.
A toxic culture was allowed to take hold and was allowed to persist. A small number of powerful leaders described in both family and staff testimonies as having infected the unit, created an environment in which bullying was normalised, speaking up was dangerous.
2,500 families gave evidence to Donna Ockenden, who found deaths were categorised as unavoidable to stop further investigation, and women who begged for C-sections were dismissed.
We are victims who became campaigners because those responsible for keeping mothers, babies, families safe failed to listen.
Jack and Sarah Hawkins worked at the hospital when all of those things happened to them. Their daughter Harriet was stillborn in 2016 after staff missed 9 opportunities to save her.
If they'd listened to us in 2016, then there would be children still alive, mothers still alive, and people not harmed.
It's why we say we need a public inquiry.
Black and Asian women and those living in deprived areas were all more likely to have their concerns dismissed. That's how Marjorie felt when she went to hospital to have her son, Jesse.
I knew something was off. I knew he wasn't in the position that he was supposed to be in, but she said to me, it's a C-section, we'll get him out. So I took her word for it. She's the professional, not me.
The report says since 2022, the Trust has made some improvements.
Where is the accountability here? Because Donna talked about individuals perpetrating this toxic culture. Where are those individuals now?
So I do recognise the accountability. That accountability is a very important issue.
But are those toxic people still in the Trust?
So this morning before I came here, I went to visit maternity services at City Hospital, talked to experienced midwives and doctors who freely told me that the culture in the Trust and maternity services has improved a lot.
Some recommendations from her 2022 report into Shrewsbury and Telford hospitals haven't been implemented. Donna Ockenden says that cannot happen again.
I will not allow that to be the fate of these actions. I will be watching.
Next week, another review will be published into failing maternity services across England. There's no shortage of reports, but families want safer hospitals.
And Stacey joins me from Nottingham. Stacey, this is all, let's be honest, depressingly familiar. What chance this review will actually lead to real change?
Well, Tom, I think that's the question many people are asking, because we've had 4 of these reviews up to now. We've had Morecambe Bay, East Kent, Shrewsbury and Telford, and now Nottingham. And Donna Ockenden is actually scheduled to chair 2 other reviews into Leeds and Sussex as well. So this problem is not going anywhere. But up to now, the government's response has been to commission its own review into maternity services across England. And as I said in my report there, that report from Baroness Amos will be published next week with an action plan of what we should do next. But as you say, all this sounds very, very familiar. But why people are feeling more confident about Nottingham's report is that while the review has been going on here, there has also been a police investigation that has been launched, that has been working with the review team. And as recently as Monday, 2 arrests were made as part of the investigation into failings here in Nottingham. And the families have said for a long time that it is personal accountability, be that in the criminal courts or indeed with a judge-led public inquiry, that will really bring about change in our maternity services within the NHS.
I'm joined now by our health correspondent, Rebecca Barry. The findings of this report are worryingly familiar.
Yeah, and I think perhaps one of the most depressing really is this familiar theme of cover-up and of victim blaming. In her report, Donna Ockenden says that she writes actually in bold with an exclamation mark that this culture of compounding harm has to stop. Her report is one of a long list of inquiries exposing failures in England's maternity services, and despite repeated pledges and policies, the data reveals a really worrying picture. There was a target to halve maternal deaths by 2025. In fact, it's increased by 20% in the last decade, and the inequalities are stark. In the UK, black women are 3 times as likely to die during pregnancy or childbirth as white women, and women living in the most deprived areas are twice as likely to die. And of course, it doesn't just cost lives. The NHS maternity negligence bill last year was an enormous £1.3 billion. That's almost half the whole negligence payout bill for the whole of the NHS. In response to today's report, the government has said that Martha's rule, the right for parents to demand an urgent medical review, will be rolled out to all England's maternity wards. And any NHS staff who refuse to take part and cooperate in these inquiries could face 2 years in jail. Next week, we're going to hear the recommendations from a national investigation into England's maternity services, but there are growing calls for a judge-led statutory public inquiry into this.